Here we have a nice educational case for female patient, 44 years old, known case of Crohn's disease. In 2023, she has this HRCT showing in the upper lobes pleural thickening, subpleural parenchymal fibrosis manifested by irregular reticulation. Fibrosis can show also traction bronchiectasis and honeycombing, as we know that the pulmonary features of fibrosis are three: irregular reticulation, traction bronchiectasis, bronchiectasis, and honeycombing. And here, in this case, we have the regular reticulation, plus of the presence of irregular pleural thickening. What else pathognomonic for this patient? There is posterior tracheal retraction. Trachea circumference should be always anterior to the posteriorly located vertebra. Whenever you see part of the trachea is seated beside the vertebra, or the whole trachea beside the vertebra, this is called posterior tracheal retraction, which is pathognomonic with the findings in the upper lobes. This is platysthorax, pathognomonic for pleuroparenchymal fibroelastosis. This is also a finding can be seen, which is called deep suprasternal notch. What else the patient have? Here we have signs of infection. In the lingula, we see bronchiectasis, segmental bronchiectasis with peribronchial consolidation. And we can see here as well tree in bud in the lateral segment of the right middle lobe. Can be seen also in the superior segment of the right lower lobe. As you can see here, there is uplifting of the fissures and the hila upward, which is consistent with upper lobar reduced volume and fibrosis, which is a feature can be seen in pleuroparenchymal fibroelastosis. Someone can ask, if a case is in a milder symptoms, elderly changes can be manifested by apical pleural capping. This is right, but presence of tracheal posterior retraction and deep suprasternal notch and presence of pleural thickening exceeding 10 millimeters and extensive parenchymal fibrosis and irregular reticulation, all these collectively together make you diagnose the pleuroparenchymal fibroelastosis. Also, the all-TB sequelae can be manifested by strandy nodular density in the apices, but almost you can see also the calcification within the strandy nodular findings, either calcification in a sheet or a nodule. This was the scan in 2023 to appreciate the findings in coronal scan. As well, you see here the parenchymal fibrosis manifested by irregular reticulation in the apices with the pleural thickening as well. And the lingula showing the bronchiectasis, peribronchial consolidation, tree in bud in lateral segment of the right middle lobe, the superior segment, tree in bud. I will show you now the scan in 2022 where the MAC was active in this patient. There was a consolidation in 2022 in the lateral segment of right middle lobe, and tree in bud can be seen here in the lateral basal segment of the right lower lobe as well. So this is the favorable location for Mycobacterium avium complex. This is the coronal scan showing the consolidation nicely in the lateral segment, in the lingula, and the tree bud in right lower lobe. Here are the tree bud centrilobar nodules and the consolidation in the lateral segment, superior segment, tree bud, lateral segment, tree bud, and centrilobar nodules, and mucus plugging as well. Patient has already established pleuroparenchymal fibroelastosis at that time, showing the subpleural regular reticulation and the pleural thickening. This patient also was scanned in 2019 and 18, and I'd like to show you the findings that they are persistent, and the infection is repeatedly occurring by healing and reactivation. Here we have we can appreciate the posterior tracheal retraction, pleural thickening, regular reticulation, uplifting of the hila, reduced volume of the upper lobes with traction and anterior displacement of the major fissures. Here we have the lingula showing the bronchiectasis as well. Right middle lobe here shows elsewhere the atrium bud. The tree bud seen here in the posterior basal segment. See that infection is repeated and recurrent and alternating location. In 2018, and this is the last scan for the patient that I have, as you can see here, the findings of pleuroparenchymal fibroelastosis is consistent in this patient since almost 5 years now. And here we have the consolidation within the lingula with distorted air bronchogram with development of bronchiectasis. And this was the last HRCT to be shown. Thanks for your attention.